Okay, so we are moving on down the diagnosis pathology list, and the next one up for the review of skeletal and soft tissue conditions will be Paget's disease. I'll be using the pathology book again. This is from Therapy Ed. The etiology of Paget's disease is largely unknown, but thought to be linked to a type of viral infection along with environmental factors. Considered to be a metabolic bone disease involving abnormal osteoclastic and osteoblastic activity. Results in spinal stenosis, facet arthropathy, and possible spinal fracture. Primary medical intervention is drug therapy, such as acetaminophen for pain control. Drugs such as calcitonin and etidronate disodium may be beneficial since they limit osteoclast activity. Diagnostic tests utilized include plain film imaging, which identifies bony changes. Lab tests look for increased levels of serum alkaline phosphatase and urinary hydroxyproline. Clinical examination assists in confirming diagnosis. Physical therapy goals, outcomes, and interventions include joint bone protection strategies that should be taught to the patient and to maintain and improve joint mechanics and connective tissue functions. So we will go ahead and go straight to the reading out of the pathology book.
Paget disease
Oops.
definition. Paget disease, also known as osteitis deformans. Paget disease definition. Paget disease, also known as osteitis deformans, is the second most common metabolic bone disease after osteoporosis. The disease is a progressive disorder of the adult skeletal system, characterized by increased bone resorption by osteoclasts and excessive, unorganized new bone formation by osteoblasts. Eventually, the normal bone marrow is replaced by vascular and fibrous tissue. Although Paget disease is a state of high bone turnover, the excess bone that is formed lacks the structural stability of normal bone, enlarged bone but weakened, leading to complications such as deformity, fracture, arthritis, and pain. The disease may involve one or more sites. Incidence and prevalence. Paget disease is a common disease of the aging adult population, rarely presenting before age 35 years with increasing prevalence among adults over age 50 years. Approximately 3% of the population over age 50 years and 10% of those over age 70 years may be affected, with the prevalence decreasing over the past 50 years. 592. Although still unclear, both prevalence and severity of Paget disease seem to be declining. Current prevalence is only approximately 50% of that. In 1983, 23 men and women are both affected, although a slight increased prevalence is evident among men. The disease is often familial and has an unusual geographic distribution. Populations of the British Isles and countries where migration from Britain occurred, the United States, Australia, New Zealand, and Canada, have a greater incidence. The disease is almost non-existent in Asia and in the native African and South American populations. 118 etiologic factors. The cause of Paget disease is unknown. Sir James Paget, who described the disease more than a century ago, thought it was likely a bone infection. Paget disease is often inherited in an autosomal dominant pattern, but the genetic basis of the condition is not well understood. 79 family studies have localized gene susceptibility to Paget disease at 3 different chromosomal regions. Although these defects do not appear to account for the majority of cases, the results of a number of studies suggest that variations in the protein page 62 affect the function of osteoclasts and that the production of page 62 is directed by the sequestosome-1 gene. 119 genomic studies of human sequestosome-1 gene containing a Paget disease mutation are ongoing. Because of the late age of onset of this disease, finding large families with a number of generations, with the disease has been difficult and has hindered progress in research. Environmental factors, specifically slow viruses that take years to progress to a point where symptoms become evident, may play a role in the development of Paget's disease. 74. The hereditary factor may be the reason family members are susceptible to the suspected virus. 92,137. Exactly how the viruses affect osteoclasts remains unknown. Paget's disease has become less prevalent and people are presenting even later and with less severe disease than before. Thus, environmental factors may be an important etiologic factor in this disease. 23. Pathogenesis. Traditionally, Paget's disease has been considered a disorder of the osteoclasts, bone-resorbing cells, rather than the osteoblasts, bone-forming cells. However, osteoblasts are major regulators of osteoclast development and function, and a tightly coupled pathway of communication and collaboration is evident between these two groups of cells. The exact mechanism by which these two cell types contribute to the formation of Paget's disease is under investigation. An initial resorptive stage where abnormal osteoclasts proliferate unrestrained is evident. The bone resorption is so rapid that osteoblastic activity cannot keep up and fibrous tissue replaces bone. Radiographically, the resultant lytic areas are sharply defined and appear as flame or wedge-shaped. The initial resorption stage is followed by abnormal regeneration called the osteoblastic sclerotic phase. In the sclerotic phase, the normal cancellous architecture is replaced by coarse, thickened struts of trabecular bone, and the cortical bone is irregularly thickened, rough, and pitted. The abnormal arrangement of the lamellar bone, separated by so-called cement lines, gives the bone the look of a mosaic. Although heavily calcified, the bone is now enlarged but weakened with a chaotic woven pattern, rather than the well-organized lamellar structure seen in normal bone. Involvement of the vertebral bodies presents with a picture frame appearance radiographically as the cortical shell and end plates become greatly exaggerated in comparison to the coarse, cancellous bone portion of the vertebral body. Fig 24.8. The final stage of the disease is characterized by little cellular activity. 27. Clinical manifestations. Paget's disease begins insidiously and progresses slowly. In mild cases, a person may have a few symptoms or may be symptom-free over a very long period, eventually presenting with bone pain and skeletal deformities. When Paget's disease is active in several bones, overactive osteoclasts can release enough calcium in the blood to cause hypercalcemia, resulting in fatigue, weakness, loss of appetite, abdominal pain, and constipation. 5. Musculoskeletal. The progressive deossification that weakens the bony structure primarily affects the axial skeleton. The lesions occur at multiple sites, particularly the skull, spine, pelvis, femurs, and tibias. Pathologic fractures can occur in any bone. Figure 24.9, especially in the proximal femurs, pelvis, and lumbar spine. Affected bones change in size, shape, and alignment, resulting in bone pain, deformities, fractures, and arthritis. Box 24/7. The most common presenting symptom is pain, which may be of a headache, radicular, osteoarthritic, muscular, or other skeletal origin. Pain from periosteal irritation of involved bones is deep and boring, worse at night, and reduced but not eliminated with activity. In some people, this pain may be referred to nearby muscles and joints. 161 clients may also experience fatigue, lightheadedness, and general stiffness. New onset of pain may be related to pathologic fracture of the vertebral bodies, pelvis, or long bones. Damage to the cartilage of joints adjacent to the affected bone and distortion of the normal joint alignment from bony changes may lead to osteoarthritis. The osteoarthritis is often more disabling than the Paget's disease itself and will not respond to treatment of the underlying bone disease. 41. Clinical findings also include postural deformities such as increased thoracic kyphosis and bowing of the femurs and tibias. Fig 24.10. Bony softening of the femoral neck can cause coxavara, reduced angle of the femoral neck, and may result in a waddling gait. These changes may produce increased local mechanical stresses resulting in pain. Neurologic Paget's disease of the skull and spinal column can produce neurologic complications as a result of either direct impingement, myelopathy, or ischemia related to a Paget's Disease syndrome. Hypervascular Paget's bone steals blood from the neural tissue. 161. Affected individuals also report tinnitus, vertigo, and hearing loss. Typical neurologic deficits include eighth cranial nerve involvement with hearing loss related to involvement of the ossicles or bony foraminal encroachment. Headaches may occur if the skull is involved, and the forehead may enlarge as the amount of bone in the skull expands and the foramen for the cranial nerves becomes smaller. Figure 24:11. Other nerve or spinal cord compression syndromes may occur as enlarged pagetic bones put pressure on various nerve structures. Findings may include myelopathy, spinal stenosis, radiculoneuropathy, cauda equina syndrome, peripheral nerve entrapment, carpal and tarsal tunnel syndromes, and any of the effects of cranial nerve compression. 161 cardiovascular. Other findings may include mental deterioration, Paget's disease causes reduced blood flow to the brain, and cardiovascular disease, rare. The cardiovascular disease is due to vasodilation of blood vessels in the bones and skin and subcutaneous tissues overlying the affected bones. When 1/3 to 1/2 of the skeleton is involved, an increase in cardiac output may be severe enough to cause heart failure. This is the most common cause of death in people with advanced Paget's disease. 161 medical management diagnosis. Because Paget's disease progresses slowly and the severity of the disease varies considerably among individuals, it may be many years before a diagnosis is made or the person may be misdiagnosed with arthritis or other disorders. In fact, the diagnosis is often made incidentally on the basis of radiographs or laboratories tests done for other conditions. A screening test that measures alkaline phosphate blood levels can be used to detect those at risk of Paget's disease. Alkaline phosphatase is an enzyme that is produced by bone cells and overproduced by pagetic bone. Siblings and children of those with Paget's disease may have a standard alkaline phosphatase blood test every 2 or 3 years. Alkaline phosphatase levels can also be used to diagnose Paget's disease and to monitor response to therapy. See Table 45. If the alkaline phosphatase level is above normal, other tests, such as the bone-specific alkaline phosphatase tests, bone scan, or radiographic examination, can be performed. The diagnosis is usually based on the characteristic bone deformities and radiologic bony changes. Bone scans are positive only if the disease is active and marked by rapid bone turnover, but provide information that helps determine the extent and activity of the condition. Bone scans must be confirmed by radiographic examination, as other conditions are also accompanied by a metabolically active lesion. A bone biopsy may be performed for a medical differential diagnosis to rule out hyperparathyroidism, bone metastasis, multiple myeloma, and fibrous dysplasia. Treatment. The goal of treatment is to normalize bone health for a prolonged period. Inhibitors of bone resorption, nitrogen-containing bisphosphonates such as orelendronate or risedronate, are the first line of treatment. 119 These pharmacologic agents, see box 24.3, decrease bone turnover through the inhibition of osteoclastic activity to improve bone density and reduce fracture incidence. These pharmacologic agents have a long-lasting effect on biochemical processes and provide long-lasting remissions in the majority of people. 55 Treatment response is assessed by the extent of reduction of the biochemical markers of bone turnover, especially plasma total alkaline phosphatase. The goal of treatment is to induce full remission through normal levels of alkaline phosphatase and prevention of complications of the disease. 107 Some experts in the field are recommending treatment of asymptomatic people who have active disease at sites where complications are likely to develop, although no data are available at this time to prove that complications can be prevented by pharmacologic intervention. 119 individuals under long-term oral bisphosphonate use are treated with caution because of the potential side effects, especially osteonecrosis of the jaw. ONJ.96 will controlled. Prospective clinical trials on the effect of oral bisphosphonates on bone are needed to determine which individuals may be at risk for such complications. 123. 162 Management of Paget's disease depends on the degree of pain and extent of the pathologic changes. Non-steroidal and other anti-inflammatory agents are used to control the pain. Surgical intervention may include fracture repairs, occipital craniectomy to relieve basilar nerve compression, tibial osteotomy if the deformity is severe, and joint replacement, if severe degenerative joint disease is present. Figure 24:12. Prognosis. The course of Paget's disease varies widely from stable and asymptomatic to rapid progressions of signs and symptoms. The outlook is generally good. particularly if treatment is given before major changes have occurred. Biochemical remission with bisphosphonates is achievable in a majority of individuals. 144 Paget disease is accompanied by osteogenic sarcoma in less than 1% of all cases, but represents an increase in risk that is several thousand-fold higher than the general population. 49, 50, 88. There may be a link between the putative gene for Paget disease and the tumor suppressor gene for osteosarcoma on chromosome 18q8. 88 peak incidence of the associated sarcoma occurs in the 7th and 8th decades. Tumors tend to be high-grade and found in areas commonly affected by Paget disease, especially in the pelvis, femur, humerus, and skull. Metastases have often already occurred at the time of discovery. Prognosis for individuals with Paget sarcoma is poor and is unrelated to the site or stage of presentation. 30 Little progress has occurred in the treatment of Paget sarcoma over the years despite improvement in the treatment of standard osteosarcoma. 83 See Chapter 26 for an overview of osteogenic sarcoma. Special implications for the therapist. 24 Paget disease. Although Paget disease and osteoporosis can occur in the same person, these are completely different disorders, with different causes. However, despite their marked differences, considerable overlap is evident between Paget disease and osteoporosis regarding interventions and implications for the therapist. See osteoporosis above. The overlap includes the discussion of client injury during examination and treatment, recognition of possible fracture, and post-operative care. For a discussion of fractures and fracture prevention, see Chapter 27. Screening assessment. Other important considerations exist for the therapists. If working with an aging adult population, therapists need to be aware of the symptoms and signs of Paget disease, because pain is often the initial symptom and is usually a vague diffuse ache. Difficulty in distinguishing this disease from degenerative joint disease of the lumbar spine, hips, or knees can be evident. Clients with diffuse headaches may present to the therapist with undiagnosed Paget disease. These clients may report hearing loss, tinnitus, incontinence, diplopia, or swallowing difficulties, slurring of speech, or the onset of signs or symptoms associated with heart disease is evident. The presentation of any of the above clinical manifestations warrants communication with the physician. Awareness of the side effects of anti-inflammatory medications is also important. These side effects include indigestion, nausea, vomiting, melena, tinnitus, hearing loss, vertigo, and hyperapnea. Again, if any of these signs or symptoms are reported to the therapist, communication with the physician is warranted. Exercise and Paget disease. Exercise is very important in maintaining skeletal health and is recommended for people with Paget disease. Joints adjacent to involved bone may function to mechanical disadvantage, causing muscular pain that can be reduced with exercise. Strengthening muscles can also help minimize skeletal complications of Paget disease with its mechanical stresses and resultant structural abnormalities of bone. 97. 161 The pain associated with Paget disease often leads to less physical activity in daily life. Loss of muscle strength, joint motion, and cardiovascular endurance occur, leading to functional limitations such as slower walking and shorter distances. 81 Exercise helps with weight control, improving cardiovascular function and cardiac output, and maintains muscular strength and joint motion. 139 Severity of Paget disease will determine the exercise program. Stretching, strengthening, endurance, aerobics, balance, and coordination exercises are all important. Some types of exercise should be avoided, such as jogging, running, jumping, and if the spine is affected, forward bending and twisting exercises. 139 Complications of orthopedic surgery on pagetic bone include hemorrhage, infection, pathologic fracture, delayed union or non-union, and aseptic loosening of the hardware. The therapist may be involved in management of extremity deformities requiring management with orthotics. Goodman, Catherine C. Pathology, E.
Okay, that's the end of the reading. So let's see what we can find out on YouTube.
On our YouTube channel, you'll find a limited selection of pathology and patient videos. With Osmosis Prime, you'll get access to over 700 videos, including complete coverage of pathology and physiology, and a growing collection of pharmacology and clinical reasoning topics. Try it free today.
Paget's disease of bone is a disorder in which there's a lot of bone remodeling that happens in some regions of the bone. Typically, there's excessive bone resorption followed by excessive bone growth, and that leads to skeletal deformities and potential fractures. Normally, bones undergo a continuous process of remodeling. Old brittle bone tissue gets reabsorbed by multinucleated bone cells called osteoclasts, which have 5 to 20 nuclei per cell. The resorbed bone tissue gets replaced by a new one made by another type of bone cell called an osteoblast. At the cellular level, the process begins when osteoblasts release receptor activator of nuclear factor kappa beta ligand, or RANK-L for short, which is a substance that binds to RANK receptors on the surface of an osteoclast. When RANK-L binds to the RANK receptor, it activates the osteoclasts, and they start secreting lysosomal enzymes like collagenase as well as hydrochloric acid. Together, they digest the collagen protein and dissolve the minerals that make up the bone matrix. Once there's been sufficient bone demineralization, the osteoblasts secrete another substance called osteoprotegerin, or OPG for short, which binds RANK-L and prevents it from activating the RANK receptors. This causes the osteoclasts to stop demineralizing the bones. Once that happens, the osteoblasts start secreting a substance called osteoid seam, which is mainly made up of collagen and acts like a scaffold upon which calcium and phosphate can get deposited. And that's how new bone begins to get formed again. The exact cause of Paget's disease of bone is unclear, but it can get triggered by infections like the measles virus and is linked to genetic mutations like the SQSTM1 mutation, which encodes a protein involved in regulating osteoclasts. When Paget's disease of bone occurs, it can affect a single bone or the whole skeletal system. Most often, it involves the skull, lumbar vertebrae, the pelvis, and the femur. Now, there are 3 main phases to the disease. Phase 1 is the lytic phase, and that's where osteoclasts which have up to 100 nuclei start to aggressively demineralize the bone up to 20 times more than normal. Phase 2 is the mixed phase, and that's where the lytic phase occurs alongside the blastic phase. In the blastic phase, there's a rapid but relatively disorganized proliferation of new bone tissue by an unusually large number of osteoblasts. The result is that collagen fibers are deposited in a haphazard way. Phase 3 is the sclerotic phase, and that's where new bone formation exceeds bone resorption. And the final result is bone that's structurally disorganized and therefore weaker than normal, healthy bone. Eventually, the osteoblastic activity also slows down, and there's a dormant state in the disease, called the burned out state. Early on, Paget's disease of bone doesn't typically cause symptoms, but over time, the misshapen bones can impinge on nerves and cause pain. In addition, if the skull is involved, the overgrowth of bones can make a person have a lion-like face, which is called leontiasis. The bony overgrowth can also narrow the auditory foramen and impinge on the auditory nerve, leading to hearing loss. If there's bony overgrowth that impinges on the optic nerve as it passes through the optic canal, that can lead to vision loss. Sometimes the accelerated bony growth can lead to genetic mutations that cause a bone cancer called osteosarcoma. When that happens, it's referred to as Paget's sarcoma. Other bony deformities from Paget's disease of bone include kyphosis, which is an excessive curvature of the spine, making a person face down to the ground. Lower limb muscle weakness, from misshapen vertebrae compressing the spinal cord, and pelvic asymmetry. It can even lead to bow legs if the femurs get too weak to support a person's weight, and they begin to bend over time. If the parts of the bone that are involved in a joint become affected, it can result in arthritis or joint inflammation. The diagnosis of Paget's disease of bone is usually done by checking for elevated levels of alkaline phosphatase. In addition, an X-ray might show lytic lesions during the lytic phase of the disease, or thickened bone cortices in advanced cases. Finally, a bone biopsy is usually done to exclude malignancies, which can mimic some of the findings of Paget's disease of bone. Treatment of Paget's disease of bone includes pain relievers as well as anti-resorptive medications like bisphosphonates, which slow down the bone lysis. In addition, surgery can help correct bone deformities, decompress an impinged nerve, and reduce associated fractures. Alright, as a quick recap. In Paget's disease of bone, there's an excessive amount of bone resorption and haphazard bone growth. There's a lytic phase, a mixed phase with both a lytic and blastic component, and a sclerotic phase, which results in weak bones. Paget's disease of bone is usually asymptomatic, but can result in weak, misshapen bones that cause fractures and lead to nerve compression. Learn medical knowledge more efficiently with Osmosis Prime, the one-stop shop for exclusive videos, personalized study schedules, practice questions, flashcards, and more. Sign up for a free 2-week trial today at osmosis.org/free trial.
All right. So that concludes this video on Paget's disease.